Dangerous new strains of the coronavirus have kicked the race to vaccinate into high gear. The White House says the U.S. is now averaging more than 1 million shots per day. More than 24.6 million doses have been administered, and President Biden says the nation will have enough supply to vaccinate 300 million Americans by the end of summer. And still, vaccine distribution remains chaotic. CBS News has learned members of the military will soon be dispatched to help FEMA administer shots. The number of hospitalizations has fallen in recent weeks, but the CDC warns there are still dark days ahead. The total number of U.S. cases have climbed to above 25.5 million, and the death toll stands at more than 427,000. January has been the deadliest month of this pandemic yet, with nearly 80,000 lives lost. Meanwhile, the debate over reopening schools has intensified. The CDC says masks and social distancing may be enough to resume in-person learning, but unions are concerned about teacher safety. Jonathan Vigliotti begins our coverage in Los Angeles.
Tonight, the Biden administration under growing pressure to get the rollout right. CBS News asked the White House's COVID response team if it would use the Defense Production Act to manufacture more vaccines.
That's something that's under active exploration. As you can imagine, it's not as simple as walking in and flipping a switch.
Also tonight, CBS News learning that FEMA, which is about to set up as many as 100 vaccination sites around the country, has now approached the Defense Department, asking for up to 10,000 service members to help administer doses. And the CDC confirming it is actively looking into mandating that all air passengers be tested before boarding, and that would include all domestic flights. This as the variant first found in the UK has now been detected in at least 28 states, including Alaska. The strain at least 50% more contagious. Researchers scrambling to find out why.
I think the better way to think of it, rather than being more transmissible, is that it's just a little stickier. And so if you're exposed to it, you're more likely to get infected.
To protect against the new variants, the CDC now asking all Americans to spend less time at grocery stores and to double mask.
We have to be concerned looking forward at what the further evolution of this might be.
California ranks near the bottom for the percentage of doses that actually get into people's arms. We found one possible reason why in this line. Hundreds waiting up to 4 hours at this health clinic. California has shifted its vaccine priority to seniors over 65. That would include Neil Getz.
What has it been like?
It's very disorganized and confusing.
The non-socially distanced line is filled with the most vulnerable, and Getz says his story is typical.
It either shows every date full, so they keep taking you 1, 2, 3 levels, and then to go back and start again. We understand that the vaccine supplies are finite. We only have so many, and we need to get them into people.
And California has created a website that will notify those who sign up when a dose is available. Still, the supply and the management of it can't keep up with demand tonight. Lana?
Thank you, Jonathan. The debate to reopen schools is heating up. Health experts say there's little evidence that in-person learning significantly increases community transmission, but teachers' unions are putting up a fight. Meg Oliver has the latest.
We relied on science and data to help inform every step.
After almost a year of virtual learning, Philadelphia's youngest students, pre-K through second, will see the inside of a classroom in February.
We have an obligation, and we must take action now.
This comes after the Centers for Disease Control announced if precautions are followed, there's little evidence of transmission in schools. In addition to face masks, physical distancing, and increased room ventilation, schools need to limit risky activities like indoor sports and restrict indoor dining.
Schools closed is a national emergency. We are seeing the devastating costs just pile on top of each other.
Joseph Allen is the director of the Healthy Buildings program at the Harvard School of Public Health.
If schools follow these guidelines, is there any reason for the teachers' unions not to return?
No, really. I mean, the new data we're seeing supports what we've seen, that schools are not contributing in meaningful ways to community spread.
But across the country, the divisive debate rages on between districts and teachers' unions refusing to return. Tonight, the nation's third largest school district, Chicago, is on the brink of a teacher strike.
My message to the teachers' unions is we need you guys.
Tamika Hinton is a single mom of 10-year-old Destin in Chicago. She had to move in with her grandfather after cutting her work hours to stay home to supervise virtual learning.
How long can you maintain this?
Not long. To try to do e-learning is really hard.
Currently, one reason unions are pushing back on returning is because there are only 23 states that prioritize teachers for the vaccine. In New Jersey, there are still hundreds of districts like Montclair with no date on the calendar to return in person. Lana?
Thank you, Meg. For more, I want to bring in now Dr. Teresa Amato. She is the Director of Emergency Medicine at Long Island Jewish Forest Hills. Dr. Amato, thank you for taking time to be with us. As we saw in Meg's piece, a new CDC report found that there's little evidence of schools contributing to, quote, meaningful community transmission. What will it take to get kids and teachers back into schools safely? I'm wondering if vaccines for school staff are, in your mind, a necessary prerequisite.
So I can imagine the frustration for teachers right now because different states vary on who is at the top of the list to get vaccines. And depending on what state you're in, a teacher might be really high up on the list and be able to get vaccinated rather soon. Some other states have put them a little lower on the list, and I can imagine that's very, it's very frustrating. They want to get back to work, but they want to also be safe. The schools are trying to take every precaution they can with distancing, putting up barriers, having the kids wear the mask, really trying to decrease transmission. And I think every school district is unique and is doing the best they can. I do think once we are getting the vaccines out, at much higher rates, then hopefully this will be a much safer place for the teachers to get back to what they truly want to do, which is be in class with their students.
But I guess I'm going to maybe put you on the spot a little bit by coming back to the original question and asking specifically, do you think that teachers ought to be vaccinated before school districts resume full in-person learning?
So I think that is a really great question, but I think unfortunately it may not actually roll out that way. Right now we still have a paucity of vaccines. And so I think, the push to start opening schools, there is definitely an effect on children that are not socializing and not going to school, as well as parents who can't go to work. So there's many sides to this. I think ideally it would be, an ideal world is that all of the teachers would be vaccinated before they would back to work. I don't think that is a realistic goal right now, but I do think that the school district should do everything they can to keep the teachers as safe as possible, with all of the social distancing and mask wearing and hand sanitizer, and again, in the plastic barriers they're putting up. I do think that's the next best way to do it. We will get this vaccine out there, but until that happens, I think we're still going to have to stay with the measures we've been using.
All right. Dr. Amato, I want to talk to you a bit about the variants. The FDA says that these variants that were first found in the UK and South Africa are beginning to impact coronavirus tests. Can you explain this to us, and how big of a concern is it?
So there's not just one test. So I think it's just a little bit of a misconception that when you go for a COVID test, everybody's getting the exact same test, and that's just not true. Different labs use different tests to detect the virus, and they look for different parts of the virus to detect it. So what the FDA does is they actually keep track of every testing center that they have given the go-ahead to do these tests. And if they see that some of these variants will not be detected by those tests, they are informing those labs immediately that there's a possibility that the variant will not be detected using their particular test, which means people will have to be somewhat fluid. And if there is a large number of variants and there's testing that won't pick it up, we'll have to switch to a different type of test that already exists that will be able to detect the variant. So some of the tests will still pick up the variant without a problem, but some of the tests may not be as sensitive, and we could have some false negatives. So the FDA is really going to have a handle on this of which test will still detect the variant.
That is concerning. All right. Well, the coronavirus variant that was first discovered in the UK is now in 28 U.S. states. Current vaccines are believed to be effective against the new strains. You and I have discussed this in the past, but Dr. Anthony Fauci says we need to stay ahead of other emerging variants. That's the news now. So how exactly do we do that? Is there a way to prevent the virus from mutating any further? Is there something that we ought to be doing as regular Americans?
So we can't stop the virus from mutating. That's what viruses do. I think what Dr. Fauci was referring to is really trying to stop the spread of any of the variants or any of the original COVID, because the more that it spreads, the more chances it has of just mutating. So there is nothing that we can do to stop it per se, but if we can decrease the transmission, we decrease the amount of virus, and then we decrease its chance of mutating. So, really talking about these masks and distancing and hand washing. And then as the vaccines become more and more ubiquitous, hopefully, that will decrease the transmission ultimately. But trying to decrease the transmission is really the only chance we have of decreasing the mutations.
All right. Dr. Amato, before I let you go, one last question about vaccines. More than 24.6 million vaccine doses have been administered in the U.S. at this point. President Biden says we'll have enough doses for 300 million Americans by the end of summer. That would be tremendous news. But what challenges still exist in order for us to get this pandemic under control?
Yeah, so really this vaccine rollout has been, it was difficult. We knew it was going to be difficult. And when you really come down to it, it's the logistics, right? Getting it from that last mile, from a delivery and then into somebody's arm. That's really what we need to do. It is frustrating to want to get this out to so many people. I do think, though, that I think it's realistic that we might be able to get the amount that the president and Dr. Fauci has been saying. But that's really going to be the game changer when we really get those vaccines into arms.
All right. Well, we continue to hope for it and wish everybody like yourself who's working on the front lines well. Thank you, Dr. Teresa Amato.
Thank you so much.